I do. It's a question for a colleague. With so many COVID patients on ECMO machines, what's your plan for patients seriously ill with heart conditions who can't get in for cardiac surgery, and how many cardiac patients have come to harm as a result of the shortage of ECMO machines and specialized staff?
Yeah, so ECMO, we call it. So it's extracorporeal membrane oxygenation. It is a very highly specialized treatment, and it was designed particularly for heart bypass, where you had to do surgery on the heart, and you needed to take the blood out of the body and oxygenate it and put it back in during that those types of procedures. What we have learned, and really starting in the early 2000s, is that it can also be very helpful for supporting people whose lungs are infected or damaged for other reasons, where the blood is not getting oxygenated. So using it for respiratory infections like COVID is a different use of the same machines. And one of the things that came out of the pandemic, the influenza pandemic in 2009, is the use of ECMO and how it can be helpful to keep people alive, essentially, until they survive their infection. So it is something we've been learning a lot about. I will say that we have a very tight-knit and coordinated group that uses ECMO, and the perfusionists that are highly skilled at how to put people on these machines, how to monitor them, when to do that. And our critical care team in BC has been coordinated from the very beginning of this pandemic and has been working with both the cardiac and with the COVID response, the ICUs, to make sure that the machines are available for people who need them, whether it's for urgent cardiac surgery, whether it's for recovery from COVID. So we have been looking at the best models for how that type of care can be delivered effectively. And as you can imagine, with many of these very intensive treatments, there's a small number of people who require these types of treatments, and there's a very highly specialized team of people who administer them. So they've gone to an approach here in the province of supporting across the province with the critical care network, and done an amazing job. So I am not aware that there has been people who have who have had issues, either cardiac or from COVID, because they have not been able to access ECMO when it was needed. And that is a testament to the teams that are working on this across the province. And I can't say enough the amazing work that they have done. And we've been following that very closely. So it is something that we were challenged, and it was stretched very much in April. But the teams have come together and have done an amazing job at caring for people.